Crackles in the lungs, fever, cough, trouble breathing. Think pneumonia and don't miss the warning sounds. Pneumonia is an infection in the lungs. The air sacs fill with fluid or pus, making it harder for oxygen to move in and out. One big clue is breath sounds. Pneumonia often causes crackles, decreased breath sounds, or coarse sounds over the affected area. Patients may also have fever, cough, fatigue, chest discomfort, shortness of breath, and low oxygen levels. First priority, assess airway, breathing, oxygen level, and work of breathing. Listen, look, and act quickly. Sit the patient upright to help lung expansion, and give oxygen if ordered to improve oxygenation. Encourage coughing, deep breathing, and use of an incentive spirometer if appropriate. These help open the lungs and clear secretions. Hydration can help thin secretions, and antibiotics are often needed when pneumonia is caused by bacteria. Keep monitoring lung sounds, oxygen saturation, temperature, respiratory rate, and signs that the patient is getting worse. If the patient becomes more confused, more hypoxic, or works harder to breathe, that's a red flag. Escalate care fast. So remember, pneumonia can bring crackles, cough, fever, and low oxygen. Nursing care focuses on breathing, positioning, oxygen, and close monitoring. When you hear crackles and see breathing get harder, think pneumonia. Assess early, intervene quickly, and protect oxygenation. Join us at the Nurse Scrub Club, where we make complex nursing topics simple and memorable. Bye for now.